For me, it all started, I used to live in Southeast Asia and China for work. So I always had starting to have like a stuffy nose, some breathing problems, a lot of running nose, but to the point that it was really impacting my life. But then I blame it, I was young, so I always blame it. It may be allergies, it's just the humidity because I'm a European in this country that is very humid. So that's when it started. And so I went to the doctor, but they would just solve everything with antihistaminics, just a quick relief so you can keep working. And I actually never paid attention to it until it got so bad. But I would say I started to have symptoms more than 10 years ago. So it was November 2023. So my nasal blockage became so bad that it was severely impacting my quality of life. It was really, I couldn't work well. The people was staying away from me because, it was the COVID, the end of COVID and with the stigma, and they thought I was sick. And so it was until that, the point that it impacted my life so much that I have to go to my primary care doctor and tell her, I think we need to deal with this because this is not just like allergies, or this is just not something but the humidity. I'm in a different weather now. I'm in Austria, this is not humid. But I had to push a little bit for that diagnosis. It was not given to me directly, let's say. Healthcare professionals, they themselves need to have some time that we know they don't have to get that extra training or extra education on those conditions, especially primary care. We know how overwhelmed they are, and they only have 5 minutes to see a patient. So they have to go from a patient doesn't not only have nasal polyps, they have a plethora of other diseases, right? So that your primary care doctor will go from whatever is more urgent, life-threatening, and if you have time, it will reach to the things that are just annoying, right? For your quality of life. So I think first education, and I think they need to have a more clear guide or to move your case to the specialist early on, instead of keeping you in primary care for those issues, because otherwise you get stuck in the system for ages, right? So that's an obstacle that we need to overcome somehow to get an early diagnosis before your disease advances to the point that it impacts your life so much, right? Early diagnosis, early detection is always it's always the best.